Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And we're back, and we are moving into our first conversation for this morning. We are joined via Zoom by Dr. Jorge Hidalgo, who is an internist at Belize Healthcare Partners. Good morning.
Good morning, and thanks for having me one more time.
Well, we're always grateful to have you on air because you help to update us with the latest information and put it all into perspective. And I want to start there by just hearing from you your reactions as to how we have been seeing the increase in deaths and the rapid increase in cases. What's your perspective here, Dr. Hidalgo?
Well, let me start saying that as the world overall, we are experiencing one in lifetime pandemic that is causing an untold human suffering and deaths and revealing social relationships and robbing individuals' livelihoods as well as countries' prosperity. Essentially, this pandemic has put all the health systems in the world in a very difficult position. And of course, we can see the different inequalities. And one of the most important things, the inability to essentially working together, especially that's an important thing. Just for today, as we see what is happening in the world, we see a total of 54 millions of global cases, almost reaching the 55 millions, with a total of global deaths of 1,318,000 and 884 deaths, of course, leading by the countries with the major population like the US, Brazil, India, and importantly, our neighbor, Mexico. I mean that Belize is not escaping to that reality, and it's something that we've been discussing our last meeting here at Open Your Eyes. We were discussing with Mr. Lizarraga, the possibility of have this surge of cases, and it's something that we was expecting to happen, and now essentially we are seeing something that we anticipate and everybody was anticipating. Mean that we are not essentially different from other parts of the world, and of course many things we need to play an important role, and one of these is human behavior. Is despite of you guys and as well as other social media and all efforts to insist on the different aspects of social distancing, it's been challenging to bring the message, and also, but most importantly, that the people take the message as such and put in practice. I mean, there is a combination of things that it essentially it put us in where we are right now. Now, what to expect? If we see the trend, we're expecting that by the end of the week, and probably by the early next week, we will see an increase of number of cases. And the other aspect is the storm that put a lot of vulnerable people at risk. I mean that it's a combination of multiple factors. It can be changed, something that can be done. I believe many things can be done, and it's a combined effort.
Months ago, we were talking about flattening the curve. That's not so much a part of our conversation, but that's essentially what we need to be working towards, right?
Sorry, I couldn't hear your question.
We should be working towards flattening the curve.
That's correct, and I think so. one of the most important aspects we see is that this pandemic essentially put also the building of resilient health systems. I mean that we need to see and combine along with our health system with efforts to make all these different strategies with the idea to flattening the curve. You know? With the understanding that we don't need to be surprised, and as far as it's difficult to say that in the following probably week or two, probably we can see we will continue to see some more deaths. No, it's inevitable, but of course we need to make all the efforts at this moment to put in practice different strategies from the Ministry of Health that I believe they are doing it already, and as a society, we've been saying that, and we definitely insist that as a society we need to play our role on trying to put in practice the things that we've been saying over and over and over, but now more than any moment of any time in this pandemic in Belize, we need to ask to please follow social distancing, as well as trying to avoid any gathering is not needed, and if it's definitely required, trying to wear your mask. Remember that the virus in indoor environments is and with poor ventilation is one of the most important areas for spreading. I mean that we need to have those things in consideration.
And I think the research has clearly shown that it's colleagues, that it's close friends, and it's family that are more likely to pass on the virus to you. But I want to shift perspective for a moment, because there is a critical situation that is brewing. I asked you before we went on air, as I know you are at Belize Healthcare Partners and you have a COVID-19 unit. The capacity of the treatment institutions for COVID-19 is quickly filling up. Let's talk about your situation there and what we know about KHMH to put it into perspective. Because if we hit that capacity mark, what happens then?
Yes, well, as I mentioned in the beginning, and we discussed, when we have each hospital needs to have something that we call it a surge preparation plan. That means that, and we talk with Dr. Arriaga very often. Dr. Arriaga leads the COVID-19 unit at Cal Huchner, and we work together in manages cases with COVID. And Cal Huchner in particular is strategizing. They have the COVID-19, but also they already have in plan some other areas in case of this particular, or the area they are using right now go to a full capacity. No? And the same thing happened in all the hospitals. You know, they need to have the surge capacity plans in terms of the normal area that they have designated as a COVID or get into a full capacity. They need to prepare some other areas, like in other countries. They use the pediatric wards, they use the surgical wards, especially the areas for elective procedures, or mean that there are many things that they are already putting in place, thinking or taking in consideration that we eventually can go into that point. Hopefully it's not the case, but we need to anticipate based on what we're seeing.
But isn't it also, I mean, putting a COVID-19 patient in a bed, in having the overflow spaces is one thing, but having the trained professionals to be able to adequately treat all of them at the same time, providing the level of intensive care that is necessary, that has a limit.
Of course, and that is something that if we see some articles in publishing in a newspaper around the world, one of the things we're facing is the lack of the training personnel deal with these particular cases. You know? Mean that among other things, among the preparation of spaces, and also one of the things that people was really concerned at the very beginning, if you remember, is do we have the exactly amount of ventilators? We can have the exactly amount, probably a huge amount of ventilators, but as you will say, do we have the exactly amount of people that can are trained to manage critical ill patients, especially patients on mechanical ventilation, is other aspect. You know, that mean that alone, as we are strategizing the different things that we need to do to prevent COVID-19. Also, the other important aspect of the strategy is building personal capacity to deal with things that we definitely are expecting. I mean, and in that case, we need to train personnel, no? And we are doing it. Dr. Mori, we are trying to, and along with Dr. Arriaga, Dr. Manzanero, and other people trying to keep training. It's difficult in those days because most of the training needs to, or some of the training, especially for mechanical ventilations, those definitely need to be face to face. You know, and with the actual situation, it's difficult to move people from the area of work. But despite of that, we are trying to do the best we can.
Yeah.
Probably
Yeah.
one of the things that we need to mention is that since April, we have been conducted a continual medical education unstop. We have already at the beginning every day, and now we are doing it 3 times a week, and with experts of from around the world. PAHO also is now joining the effort of training, and also with local expertise to trying to discuss those particular issues. And it's challenging. We need to say it's not easy, but we were trying the best we can.
Yeah.
We have over 2,000 active cases at present. Not all of these individuals are hospitalized, but we're looking at a situation where, if not already, it is quite possible that there will be an overwhelming need for this kind of critical response. Do you believe that at this point in time we're nearing that point?
Well, we always need to be prepared for the worst, no? Mm-hmm. Even that hopefully we don't reach that moment. We need to be prepared for the worst. And then if we see the trend that is being described around the world, 80 to 81% is going to be asymptomatic cases or with mild symptoms. 14% of the cases to 15% of the cases are those that probably are going to exhibit a mild case or moderate case. And 5% of the cases will end on ICU and needed ICU. No? Mean that hopefully we can keep that, but again, most important than anything, hopefully we don't need to reach the moment that our services are going to be overwhelming and in a full capacity that we need to be in trouble. No? I mean that whatever it can be done, if we see or we see the trend, we probably expect that again, as mentioned at the beginning, that by the end of the week or by probably the beginning of next week or end of next week, we can probably reach an important number of cases. It can be something can be done. I think so. Us bringing those messages and insisting on the things we mentioned already are critical, as well as the different strategies that needs to be in place from public health to trying to reduce and to prevent that we reach that stage.
So, looking forward, if we do reach there, Dr. Hidalgo, there's an issue that we don't discuss very often because it is very morbid. But across the world, we saw that when hospitals get overwhelmed with cases, and can no longer, it reaches to a point where they need to make decisions as to whose lives they're going to try to save and who will be given second priority. You noted that from April there have been discussions amongst health professionals. Has a protocol been decided on that if we do reach that very terrible phase where that decision has to be made, how it will be made?
Well, that's basically reach the points of an ethical decisions, no?
That's right.
And it's, as you say, it's not easy. It's challenging. It's been done in other countries, and it's nothing new, no. Especially when we are working on critical care units, one of the things we know is we have 3 ventilators and we have 5 patients on need of those mechanical ventilations. Then who is going to who is going to decide, or how we're going to decide who will use these 3 ventilators that we have? No, just to give you an idea.
Yeah.
But it's most of the times with Dr. Cuellar, Dr. Arriaga, and also myself, we brought the issue, and also to form an ethical committees that can help us to make that type of decisions that are not easy, because of course we want our loved ones to receive the best care as possible, and also that we can do the best we can with the resources available. But at some point we can reach a situation that can be difficult, and how you are going to say to somebody that definitely you are not qualifying to use to be put in mechanical ventilation for A, B, C reason, no?
Yeah.
I mean, that is those are the decisions that are not easy. But again, we brought the issue that an ethical committee needs to be formed in facilities that provides critical care services to be able, or at least to have the ethical committee to help us to make those type of challenging decisions, and hopefully we don't need to reach that stage, but we need to be prepared for the worst. I mean,
But it has happened in other countries. I know very early on we heard stories from doctors who were tortured by having to make a decision as to who can lead a more productive life and who gets the treatment. I mean,
remember at the very beginning of the pandemic, that's happened in Italy and Spain, that they say, well, this group of population, in case they are not definitely going to the ICU, and they are not going to be put on mechanical ventilation because of the medical background, because of the age. They are not candidates for ICU. I mean, that is already happening in those countries, and of course we are not exempt to that. No, I mean, that hopefully we don't need to reach that stage, but we need to be prepared for that. It's something that can happen based on the trend we are seeing, and then all these efforts need to be in place to offer and to take the best collective and ethical decisions that are challenging, but somebody needs to make those decisions, those calls.
I could only imagine the difficulty for anyone to have to decide on who gets access, who gets certain treatment. I mean, I could understand the ethics behind the decision making, but this is people's lives that we're discussing. And so when you take a loved one to the hospital in a case where he or she is suffering from COVID-19, and ultimately that decision lies with the doctors or a committee that will be formed to decide what happens in terms of that person's fate. It's a very tough spot for anyone to find themselves in.
Yeah, and one of the things we are before the pandemic, we were trying to develop is something that we call it the humanization of the healthcare. No? I mean that actually one of the things we were doing in ICU before the pandemic is trying to have the critical care units open to families. That way, the low one or the critical ill can spend more time with the family. But suddenly, the pandemic changed everything. I mean that you have the those patients in ICU or the patients that are in COVID-19 units with restriction of families. No,
Yeah.
I mean that part also is very shocking and very dramatic for someone who is critically ill or who someone who is ill for too many days, and also not only for the patient but also for the families to be unable to have contact with the
Yeah.
loved ones.
So, I mean, it's a very practical, it's a very realistic scenario that we've seen taking place in other countries. And as we get updates from the Ministry of Health in looking at capacity and how many people are hospitalized, it hasn't happened yet, and we hope we won't get there. So let's shift gears for a second and let's talk. There are over 2,100 active cases in the country at this moment, as of this morning. There are two scenarios that we have seen taking place in the reports of people who pass away from COVID-19. One, that people did not access healthcare services. They were ill at home and they never went to the hospital. And those who accessed too late. Dr. Hidalgo, walk us through the critical phases of people who are now active with COVID-19. What should they be monitoring? What are some of the red flags that they need to not even wait to get tested, just get to a healthcare center if that's what's necessary?
Okay, let's start saying that the incubation period for COVID-19 is in an average of 14 days, in a total of 14 days, with an average of 4 to 5 days. I mean that most of the patients will be exhibiting symptoms after 4 to 5 days, but it could be until 14 days. After that, then we know, and that's probably the most difficult part. Those that are asymptomatic, those patients that even that they get in contact with the virus, they are not going to exhibit symptoms, and that is part of the information that we don't have around the world. We don't know exactly. We probably, if we test, we will have an idea, but unfortunately, it is difficult to exercise that amount of testing in everyone, and then that part of the exact number of asymptomatic patients, we don't know. I mean that, and then probably that's one population that we need to have in mind, because we can spread the disease. No?
Yeah.
Then we have those that they are going to develop a mild symptoms. No, at the beginning we say you will have a respiratory symptoms, but now we see a variety of different other that we call it atypical symptoms. No, in the sense that you will probably experience lack of smell, lack of taste. Some other patients are going to present with general flu symptoms. That means you will have a runny nose, you will have a body ache, fever.
Sore throat.
We don't see fever in all the patients. There are patients that they don't have fever. They presented with shortness of breath, and some other patients are presenting with gastrointestinal symptoms. That mean diarrhea, stomach ache. I mean that those are some of the different symptoms that the patients can present, and then that we need to definitely go and get and seek a medical attention as early as possible, or get in touch with the family physicians.
Let's stick a pin there. So if I have any one of those symptoms, and maybe I have the upset stomach, or maybe I have a sore throat and fever, it is from that point that I need to isolate myself while I call the Ministry of Health.
Definitely. If the most important thing is if you say, okay, I been in touch with someone that probably tested positive, or you remember that probably you went into a gathering, and more likely you say, okay, I probably been exposed. But now, and in general, everybody who is presenting symptoms like those that you mentioned, sore throat, fever, are you coughing? Then we say until we prove otherwise, you more likely are positive, and it's best if you isolate yourself.
Yeah. Okay.
And there are patients that definitely, there are a group of population that they have the ability, they don't have the ability to isolate because of many reasons. Then
Yeah.
those patients need to have a different advice, and probably they need to go to the hospital. But if you have mild to moderate symptoms, then that can be managed at home.
All right, let's talk about that critical phase when it goes from, I mean, maybe I start off with just mild symptoms. How does it go from mild to severe where people are gasping for air in the hospital?
Well, the most important part is the need of oxygen, because of course the respiratory symptoms is most affected. Then we will notice one, there are many people that they have the ability to have to have those devices that measure the peripheral oxygen levels, no? But if you don't have that, just the fact that you notice that you are becoming with a respiratory distress, just to get up from your chair, or just from move from bed, or just going to the bathroom, that means that things are not good, no? Because then just to simple efforts, you are becoming with the respiratory distress, and that means that the symptoms are worsening, and then you need to go to the hospital, because the better chances are when we are be able to see the patients in an early stage, rather than essentially go to the hospital to be intubated on arrival. No, that's is more difficult, and the prognosis is not the best.
So pay attention to that shortness of breath. That's the key one that can take you to a critical phase.
Yes, definitely.
Okay.
That, and it's simple. No, you just if you see that you are not able to walk that, just the distancing from your bed to the bathroom, and you became with a severe shortness of breath, that is an indication that things are not good, and then you need to seek medical attention.
Okay. Well, we do hope people are paying attention to those symptoms. Is there a time period since you first start symptoms to maybe day 7, day 10, where you want to be extra careful?
Yes, there are definitely stages, no? And again, not everybody go to those stages, but they say that usually at the moment we start, most of the time when at the end of the first week, we can see worsening of symptoms, no?
Okay.
And then the most important part on that is one, if that you are in contact with the different telephone number that the ministry is saying, or if you have your family physician that you can be in contact and be monitored and see, okay, for the last 2 days I have this type of symptoms, but now I notice that there are new developing in my symptoms, and I'm feeling a little bit worse. Or then that way the doctor who is advising you can tell you if it is the moment to go to the hospital, or probably you can be continue monitoring at home. But it's important that especially if you are developing symptoms, that you need to get in touch with someone in the medical facility that can advise you and to guide you as what to do, especially if they are worsening of symptoms.
All right. Well, Dr. Hidalgo, thank you. That is very helpful information. As we said, there are 2,100 active cases across the country. And so we hope that they and their family members are able to understand more of critical signs to look for, and also collectively that we understand that the situation needs to improve and we have to do our part. Thank you, Dr. Hidalgo.
No, thank you for having me. And then just to remind and to stress on the things that we as society needs to do over social distancing, all that is been saying. Please put that in practice, and thank you one more time to having me with you.
All right. And with that, we're going to go ahead and take a break. When we come back, we're going to be focusing on the activities by Pathlight Belize. That's coming up after the break.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.